So this is what an example of a partial knee resurfacing or replacement looks like. This is the thigh bone, the femur, and we've placed a metal cap on the end of the thigh bone. There's a metal cap here on top of the shin bone or tibia with a little plastic liner in between. And you can, if you see a side view of that model, you can see we're only removing about 8 millimeters of bone, so not a lot at all. This is more of a traditional partial knee replacement. Now with the Mako, we're also just milling down these areas where these implants go, so it's a much tighter, more precise fit, and so you're really not removing that much bone. But this is what a partial looks like. A partial could be placed here along the medial side or the lateral side, or if you've replaced, or if this groove here called the trochlear groove under your kneecap, the patella is worn, then you could also place the cap here as well. So you can address two of the compartments, whether it's medial or patellofemoral, or you can replace the lateral compartment and patellofemoral compartment as well. A total, like, we can contrast that, and if patients have arthritis in all three compartments, kind of like this model here, you can see both the medial and lateral compartments are diseased or arthritic, and up here in the trochlear region, as well as behind the kneecap. Then we would consider a full knee replacement, a resurfacing of all three compartments, and that's what we have right here. That's a full knee replacement where there's a cap, resurfaces the entire end of the thigh bone, femur, top of the shin bone, the tibia, and there's a plastic liner in between, and then we also put a plastic liner, which you don't see behind the kneecap, which will then sit right here in the trochlear groove. So the plastic liner here is made out of polyethylene. It's a type of plastic that's been, the molecules are highly cross-linked, and so they're very durable and tough, but we still, that's the bearing surface, and that's what wears out over the years. And so we get x-rays every year to measure the thickness between the metal components to see how that it's wearing. And if you catch it soon enough, before it completely wears out, you can simply exchange the one plastic piece for another, kind of like changing a car tire, if you will. Maybe not the best analogy, but when the tread is worn down, you're able to change out that tread. So the plastic should last a good 15-20 years. If the implants are placed precisely, hopefully even longer. So that's the whole push for a robotic placement of a partial or a total knee or total hip, if you will, is that if you put the implants in more precisely, you'll get more life out of that bearing surface, that plastic liner. And over the years, the plastic has improved. So even it just keeps getting better and better, and so it's more durable. And so the hope is that, you know, one day you're able to place an implant and it can last the rest of your life.